This topic is anorexia nervosa. Anorexia nervosa is a type of eating disorder. There are multiple factors that can lead to anorexia nervosa, such as biological factors, which include changes in hormones or even a dysregulation of neurotransmitters. Psychological factors also play a role. These clients are experiencing body dysmorphia or an impaired image of their body, as well as a need for control. Clients may also have a coexisting mental illness, such as OCD. Social factors play a large role here and can absolutely impact the body image through social media, TV, and magazines. Clients with anorexia nervosa crave and seek control, so they feel most in control when they monitor exactly what they are or are not putting into their body for fuel. Anorexia nervosa can be categorized into two types: restrictive type and binge eating and purging type. We'll start with the first, restrictive type. Clients with restrictive type of anorexia nervosa will have extreme fasting, dieting, or even excessive exercise. So these clients are hyper-focused on limited intake and excessive calorie burn. On the other side of the spectrum, clients with binge eating and purging form of anorexia nervosa will eat or binge large portions of food and eat in excess, and then will self-induce vomiting stemming from guilt or shame from their binge. Clients may also purge by misusing or abusing laxatives, diuretics, or enemas to excrete their excess caloric intake and to prevent weight gain. This is most commonly seen in our adolescents or our young adults, although we can see anorexia nervosa in any age group. These clients and their adolescents are most impressionable here and are really relying on the opinion of others for their body image. They want to be accepted by their peers. Anorexia nervosa can be seen on a spectrum, so we may have a very mild case, but we can also see very severe cases that can lead to life-threatening complications due to electrolyte imbalances, which, as we know, these electrolyte imbalances can affect the heart and cause arrhythmias. So let's discuss the clinical features of anorexia nervosa. Now remember, there are multiple factors here, so we'll first highlight the physical features that we may see, and in the next slide we'll address more of the mental health aspect or factors to anorexia nervosa. These manifestations in anorexia nervosa are mainly due to a decreased caloric intake, which then the body responds by wanting to conserve energy, so the body will be running low and slow. Anorexia nervosa affects every part of the body, so let's start at the top. A decreased oral intake includes decreased glucose, which is brain food. So these clients may experience fatigue, confusion, and even fainting. Anorexia nervosa is known for a low BMI, and that's one of the most important points here. So because these clients have a small amount of fat on their body, they'll experience hypothermia and cold intolerance. The heart will also be affected. As the body is trying to conserve energy, the heart will pump slower, and the client will also experience hypotension or a low blood pressure. The GI tract will also be trying to decrease peristalsis in order to conserve energy, so the client may be constipated. The client will physically look emaciated, as you can see in this illustration. There's very little fat on the body. Musculoskeletal can be affected as well, as we have a decrease in calcium, and so the bones become brittle and can develop stress fractures or even osteoporosis in a more severe case. Muscle wasting and atrophy can also occur. The skin will be affected, and this is due to the body running low and slow, and because there's less perfusion due to bradycardia and hypotension, there's not enough blood flow to the skin, so we can have alopecia or hair loss, dry skin, or even, in severe cases, a fine downy hair production called lanugo. The reproductive system may be affected as well. Due to this low and slow regulation of metabolic demand, the client will experience a decrease in libido. Women will also experience amenorrhea, and this is due to the malnourishment. Now, it's important to remember anorexia nervosa affects women and men. Now let's discuss some of the mental health factors here with anorexia nervosa and how to best address these. These clients will be experiencing low self-esteem and body dysmorphia, or that impaired body image. These clients may exhibit an unusual or ritualistic behavior around food or even preoccupation with food activities, and this is due to their need for control. An example of this would be counting calories. We can also see manipulative behaviors and social withdrawal. These clients don't want anyone to know they're struggling with this issue, so they may self-isolate, or even if they do eat in front of others, they may just move their food around the plate and not actually eat. Anorexia nervosa is defined by a low BMI, and we can see this in mild form, but we can also see this in a very severe form, which is less than 70% of the client's body weight. At this point in severity, the client will need to be hospitalized. Once hospitalized, the client will be reintroduced to caloric intake and nutrition. If nutrition is reintroduced too quickly, the client may experience refeeding syndrome. This is an extreme complication due to electrolyte imbalances. We can also see hemodynamic instability due to the hypovolemia and again, that low and slow regulation of the body when it's trying to conserve energy. Concerning symptoms that would indicate hospitalization include refusal to eat, suicidal ideation or attempt, or even psychosis. So let's highlight some of the ways to best manage these clients. Introducing caloric intake is very important, so we need to make sure that these clients are in a nutritional rehab program. Assessing for suicidal ideation or attempt or even self-harm is extremely important for the client's safety. Monitoring the heart for any arrhythmias due to these electrolyte imbalances is important. Correcting these electrolyte imbalances is important to prevent the life-threatening complications that can occur. We also want to administer IV fluids to increase blood pressure and perfusion throughout the body. In severe cases, when the clients are still refusing to eat, we may need to introduce food via an NG tube or parenteral nutrition. Cognitive behavioral therapy can also be helpful to remold or also deconstruct these negative feelings associated with food and body image. We want the client to have a more positive outlook on their own image and eating food. Reinforcing parental monitoring during and after feeds for at least an hour is so important. This is to monitor the client's emotional state during and after the feed and to also prevent the client from purging after meals. We want to encourage the client to eat with others so they no longer self-isolate. Encouraging the client to start a diary or a journal can help them deal with these emotions they're feeling towards negative body image and with food. This can help them find other coping mechanisms once they address their own emotions. We also want to monitor for adequate weight gain as well as caloric intake. And again, one of our number one priorities is to shift the client's mindset around food and negative body image to improve their self-esteem and to see themselves in a positive light.